Animal-assisted therapy is a type of therapy that involves all kinds of animals, such as horses, in order to improve a patient's social, emotional, and/or cognitive functions. Dr. Jackie has been a licensed professional counselor for over 10 years. She is specialized in anxiety, depression, autism, and sensory integrative disorder. Dr. Jackie is dedicated to going above and beyond for all of her clients and her animals.
So we use equine assisted therapy when traditional office therapy fails. So if I get a client who comes in and they've had traditional therapy, they haven't been successful, the parents are really struggling with them and their behaviors, I'll take them out to the farm and assess them for an equine assisted therapy session. The kids can be afraid. It doesn't matter if you're afraid of horses or if you have no horse experience, because the horses will guide you through the relationship.
Dr. Jackie trains each of her horses while forming an inseparable bond with each of them. Without a bond between the horse, therapist, and the patient, there can be a disconnect and distrust between the horse and the patient. However, many animals instinctually are very caring and can sense the patient's discomfort. During equine therapy sessions, patients perform various challenges and tasks with the horse, from finger painting, giving the horse commands, or even horseback riding. The horse performs difficult tasks so that the patient can see when the horse completes a difficult challenge. The patient is encouraged to do that as well.
When the kids can help the horses get through things, they realize that they can become strong and they can get through scary things too. This is complete relaxation and complete comfort for a horse to be in their most vulnerable position and let other people be standing around them and other people be touching them. So this is the ultimate partnership right here.
Patients that are best suited for equine therapy are individuals suffering from PTSD, autism, ADHD, depression, or like 16-year-old Brianna, who suffer from sensory integration disorder.
I have a son with Asperger's disorder, anxiety, and bipolar disorder. And Brianna has anxiety disorders and sensory integration disorder. So when you consider all the different things that has to happen for either of those kids to be able to succeed, it's different things.
The difficulties I faced were mostly just tactile things, so I couldn't wear certain clothings because of where a seam might be placed or the type of material that might be used. I had a little bit of issues with sound, like mostly repetitive beeping or high-pitched noises. And then my taste is kind of very weird, so.
We wanted to take Brianna to therapy because she was born preemie, and we noticed that she had a lot of issues with wearing clothes, wearing socks, sounds, smells. She's a very picky eater, so her taste is very sensitive. And the biggest problem as she was getting a little bit older was the tactile. She couldn't wear anything but a t-shirt and one kind of jeans and one kind of shoe that would have to get in multiple sizes. The ability to wear clothing, I remember her sitting in the dressing room at JCPenney wanting to have this particular top and crying because it just felt so bad. And so I wanted to get past that, help her get past that.
Animal therapy with Jackie, I mostly just spent time with my horse or with her horses, and she would give me certain challenges that I had to finish within a certain time frame, but and she would give me and I would be given a certain task to accomplish, and it would somehow help either my anxiety or something to do with my sensory. Doesn't really know that it's helping or what's really going on, and so it just kind of, you can bond easier with the horse or whatever animal you're using. So it felt more personal. But I feel like the animal therapy actually helped me more with any of my tactile issues or with the sound issues. So I feel like I got more done with animal therapy.
I like Jackie's approach, and she explained things. I knew about animal therapy. I didn't know it was going to work so fast. She was able to explain more of the psychological, about the anxiety. I asked her about why the tactile was working so well, and she was able to explain that. So just the approach, it was very casual. It was, there was no stress about it, and it was a fun experience.
It's the movement of the horses that actually makes the children actually have to work. So, you know, they're doing a lot of effort, but it's the movement of the horse creates different movements in the body. It's the warmth of the horse, and a lot of it is also the psychological feeling of it, because they can bond with the horse much better than they can bond with people.
I saw a big difference. Once she was old enough to start riding a horse, she loved it. She was good on it. It was almost like a natural thing for her to ride the horse. Then she started riding more and more. I would just take her out horseback riding. And then we got a horse, and she rode more and more and more. And the more she rode on the horse, the better she got with the tactile, and things didn't bother her. She's out buying clothes that she would never buy before. Now she was much happier. It worked. It was a huge difference.
I was amazed at how quickly she was able to overcome some of the tactile. Within 2 months, she had riding boots and riding pants that there's no way she would have had that before. And when I saw them initially, I thought, no way. And she wore them and got used to them very quickly. Jackie also started using animal therapy for her anxiety. I also really pushed to get some occupational therapy. I thought it was going to be more effective than she enjoyed going, but that's probably because she liked the therapist. And I saw a little bit of progress, but nothing that was overwhelmingly great. I think if we would have stuck with it more or continued it, and maybe we still need to continue it, it would help her anxiety. It did at the time. Her anxiety has gone back up somewhat, but that's mainly around school and driving. So maybe we just have to ride a horse, not a car.
Oh, I would recommend animal therapy, yes, especially equine therapy.